Okay, I am Morley Wong, and I will be showing you how to perform an MR-guided breast biopsy. So, prior to this image being seen here on Dynacad, the tech will have done scout images and a pre-contrast image, and when you check those, especially the pre-contrast image, you want to make sure that your target is going to be where the grid is, and you check that not from this Dynacad image but from the actual images on PACS. And if you feel like you are going to be able to access your target in the region of the grid, then you go ahead and you tell the tech, yes, go ahead and give contrast, and you will get post-contrast images. And when you get those post-contrast images, they will be sent to Dynacad, which is a program that will help you target the right area on your MR-guided biopsy. So this is what you see on Dynacad. The first thing that you have to do on Dynacad is to mark down where your fiducial is in the grid. So in order to do that, in the program that we have set up here, we look at this in the top left, and you can right click and go down to this, which says fiducial, and that's where you would be setting where your fiducial is on the grid, and you have put that on the grid. So on this image, it is a sagittal image, and basically you scroll all the way until you see the fiducial, which will be outside the breast. So this is where the breast would be, but you don't see it on this image because you have scrolled to where the fiducial is. And when you see the fiducial here, you put the mouse on top of the fiducial and left click so you can tell the Dynacad program where your fiducial is. Now, since you have marked where your fiducial is, which is here on the grid, the next step is to go to your post-contrast image, which is subtracted here, and you want to find your target. And when you find your target, you left click on the target and you send that to the computer, the Dynacad system, and that will, see, this is me clicking on the target. So once you do that, and it's been done here, then it generates, the Dynacad program will generate your instructions on how to get to your target using the location of the marker that you put in and also the location of the target. So what this program will spit out is a map of how to get to your target. And so here it tells you, okay, this is your marker, and this is where you would put your needle in, specifically this hole right here. And this red cross demarcates where exactly your target is. This will tell you the depth. This is a circular ring that can be placed on this measuring device, and this says 7 millimeters, so this is 7 millimeters in, so that you know where to put everything to get to your target, and this is a symbol of what you would be doing during your biopsy. So this is the same thing. And what you want to do is here I went back, you want to print this up if you can and bring it into the room with you so you can check everything while you're doing the biopsy. You're not going to be able to be in the room with this machine. You will not be because of the magnetism. You will also not be able to take a picture of this and bring your phone into the machine, near the machine, because of the magnet. So you need to print it up on paper. Or if you don't have a printer for some reason, or your printer has run out of ink or something, you need to bring some sort of visual copy of this so that you have something to refer to while you're doing the biopsy. So you would save the results, and then you would go to print here. You press print, and then you print this piece of paper. And here is me holding the piece of paper with the printout. This is your target. This is what it would look like, but the main thing I'm looking at is here on the top left. It is telling me where the fiducial is. It is telling me where I should put this block, and within that block, which of the 9 holes I should be putting my needle in, which would be this one. And this is the depth, which is 7 millimeters. And it's even telling me, because my target is somewhere here at 2 o'clock, if I wanted to, I can aim at 2 o'clock to really target the target. So here's the patient lying down, and I tape this right next to where I'm working. I set up my tray like this. I have lidocaine here. I have lidocaine with epi deeper, and then I have my 11 blade. Before I even numb the patient up, I use betadine swabs, 3 of them, one right after another, to clean the square that I know I'm going to. So for example, here's the fiducial, and this is the square I'm using. Now just remember, this piece of paper is not the patient that I'm going to show you. So for example, this is the correct one for this. I'm doing the right thing for this patient, don't worry, but this patient actually had a different printout. Anyway, so for this patient, this is the square that I am doing. If I were to use the other paper that you saw, I think in that image, this fiducia would be probably right over here. But anyway, so I have example of a paper from one patient and an actual biopsy from another patient. So if you could mentally move this, I think right here, then that would match the paper. But anyway, I know this is where I'm going to be working, so I clean that off with 3 swabs of betadine. And I always keep checking, am I in the right place? I use a tuberculin syringe and give the lidocaine, and I know that, I think in that, it was like this area here was where I was going to go, so you kind of numb up the area that you think that you're going to be putting the needle. Then you numb deeper with lidocaine with epi. I set up my device, so I have a needle here, and then I have an introducer. I'll call this the introducer. You have a blue ring here, which I remember that it was around 7 millimeters. So that would be, you would move that here so that you know would know what depth you would have to go to. Put the needle inside the introducer. Yep, there I am. Needle inside introducer. And introducer is in the hole of this 9-hole plug. So I make my incision with 11 blade, put it in deep and quickly. Then I put the needle, which is inside the introducer, which is inside the block, in the correct place. So it was like the bottom right. I make sure this is straight, going straight in. And then after it's in, I pull the needle out and I put this blue device, which I will call the space holder, in. So I don't put I don't leave the needle in while the patient's getting scanned. So I take the needle out, I put this blue space holder inside the introducer, so when the patient's getting scanned, she does not have a sharp needle in her. So this is where she is. I'm putting her back inside, taking an image to make sure that I'm in the right place. This is the biopsy. This is the biopsy device here. This is the machine that controls the biopsy device, but here's the biopsy device here. There is actually another 10 cc's of lidocaine with epi connected to this machine, so that when the biopsy is being done, this medicine is going in at the same time. Now, if I think I'm in the right place, then I take out the blue space holder. The tech hands me the biopsy device. I put that into the introducer, and there is a flat part of this biopsy gun, and that's where, so I am holding it, that flat piece, at 12 o'clock. And if I wanted to take images, if I wanted to take samples at 12 o'clock, I just hold that flat piece in a 2 o'clock position, or I can just kind of go around. I usually take 6 samples at 12, 2, 4, 6, 8, 10. And after I'm done rotating this in order to get all those samples, well, and I also want to let you know how to control that sample. I'm taking, in order to take the samples, I put my foot on this foot pedal and I hold it down in order to take the samples. And at the same time, I'm turning this. I put my foot on there the whole time, so the sample taking probably takes about 30 seconds. I'm holding my foot down for 30 seconds. I am turning this. You're going to hear a sound like bzzz. That's like a sample being taken. Then I turn this, say to 2 o'clock, and I hear bzzz. And I turn it to 4 o'clock in between the buzzing sounds. Anyway, when I'm done with that, then I ask, so that was it's set on biopsy when that is on. When I'm done with that, I ask the tech to set it on lavage. So I set this, so she presses a button on this to put it on lavage, and then I am lavaging, so water's going in and then getting flushing, and that's getting pulled out. That's lavage. And when I'm done with lavage, I do this 360 around the cavity. I tell the tech to put it on aspirate, and then I turn the handle of the biopsy device 360. Then I ask the tech to put it on biopsy again, not because I'm going to biopsy, but that's kind of this. If you're not lavaging or aspirating, you're in the biopsy mode. So she puts it on biopsy, and then I can take the biopsy device out, and here's me getting the clip ready to put in. I put the clip in, and after I put the clip in, then I take the blue holding, or the spacer, let's see, what would you call that? Something that holds the space when nothing's in there. I put that there, and then we take another image, and if that image looks good, then we're done, and I send the patient off for a post-biopsy mammogram. And the reason that I do that is because you can see these markers much better on mammogram than on MRI. Okay, thank you. This is not an end-all and be-all with how to do this, and of course, just watching this will not tell you how to do this properly. You should learn from someone who is actually there with you and who is properly trained. It's just a guide. But thank you very much, and I hope this was helpful.